Right. Hello, everybody. Welcome to our Firetree webinar. Today's presentation is on Pathways to Recovery, Peer-Based Recovery Support Groups. My name is Amber Biddle, and I am the Corporate Clinical Director. Our objectives for today are the following. We're going to talk about what is recovery, recovery-related values and beliefs, different conceptualizations of recovery, types of recovery programs, research outcomes that encourage the use of peer supports, and then different types of support groups. Like any other chronic health condition, substance use disorders can go into remission. Among individuals with substance use disorders, this commonly involves the person stopping substance use or reducing it to a safer level. As it relates to healthcare, treatments that reduce major disease symptoms to normal or subclinical levels are said to produce remission. Remission is more common than most people realize. Evidence indicates that approximately 50% of adults who once met diagnostic criteria for a substance use disorder, or about 25 million people, are currently in stable remission, which they identify as 1 year or longer. Recovery from substance use disorders has had several definitions, and although specific elements of these definitions differ, all agree that recovery goes beyond the remission of symptoms to include a positive change in the whole person, including their behaviors, outlook, and identity. In this regard, abstinence, though often necessary, is not always sufficient to define recovery. According to the National Institute on Drug Abuse, recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. Even people with severe and chronic substance use disorder can regain health and social function. As people progress through the recovery, positive change and values become a part of a voluntary adopted lifestyle. According to the Surgeon General's report on alcohol, drugs, and health, the specific meaning of recovery can also vary across cultures and communities. Among some American Indians, recovery is inherently understood to involve the entire family and uses both cultural and community resources. On the other hand, European Americans tend to define recovery in more individual terms. Black or African Americans are more likely than individuals of other racial backgrounds to see recovery as requiring complete abstinence from alcohol and drugs. Within some communities, recovery is seen as being aligned with a particular religion, yet in other communities, such as the AA Fellowship, recovery is explicitly not religious, but is instead considered spiritual. Still, other communities view recovery as an entirely secular process. And later in the presentation, we'll kind of delve into those different communities a bit more. Some common threads that came up while looking into definitions of recovery included the following values and beliefs. People who suffer from substance use disorders have essential worth and dignity, whether they're actively in recovery or not. Shame and discrimination prevents individuals from seeking help, and this should be addressed and combated. Recovery can be achieved through diverse pathways, and people in recovery have valuable experiences and encouragement to offer others. So these last 2 points in particular are why we see the plethora of mutual aid groups and the importance of people continuing to seek those supports so they can learn from others' shared experiences. So due to the diversity of pathways to recovery, there can be some debate about the value of some pathways over others. Most people who define themselves as being in recovery have experience with 12-step oriented mutual aid groups, such as AA and Narcotics Anonymous, but many others enter recovery through professional treatment services, non-12-step mutual aid groups, or other routes of support. The diversity in pathways to recovery has sometimes provoked debate about the value of some of the pathways over others. For example, people who achieve recovery with the support of medications like methadone, buprenorphine, naltrexone, or even some antidepressants have sometimes been denounced by those who don't take medications, based on assumptions that using medication is inconsistent with recovery principles or a form of drug substitution or replacement. So, with some of those ideas being present in some mutual aid groups, we've seen more recently the development of groups specifically serving those populations, including the National Alliance for Medication Assisted Recovery and Methadone Anonymous. When we look into rates of people in remission versus in recovery, that can be hard to get an accurate estimate. Somebody who has met diagnostic criteria in the past for a substance use disorder might no longer identify as being in recovery. So that can kind of have an impact on results. In, again, the Surgeon General's report on alcohol, drugs, and health, they examined a study of 9,000 participants who labeled themselves as in recovery. 86% saw abstinence as part of their recovery, but the remainder either didn't think that abstinence was part of recovery in general or felt it was not important for their recovery specifically. Endorsement of abstinence as essential was most common among those who were affiliated with 12-step mutual aid groups. And this finding was consistent with research showing that the great majority of people who have experienced serious substance use disorders consider abstinence essential for recovery. 98.6% identified the importance of being honest with themselves. And other almost universally endorsed elements included handling negative feelings without using drugs or alcohol and being able to enjoy life without using drugs or alcohol. Almost all study participants viewed the recovery as a process of growth and development, and about 2/3 saw it as having a spiritual dimension. Lastly, engaging in service to others was another prominent component of how study participants defined recovery, perhaps because during periods of heavy substance use, individuals often do damage to others that they later regret. Importantly, service to others has evidence of helping individuals maintain their own recovery. A separate survey of more than 3,000 people in recovery indicated that fulfilling important roles in being civically engaged, things like paying taxes, holding a job, being a responsible parent, became more common after their substance use ended. So again, we'll see these components coming into play when we look at specific mutual aid groups. I wanted to take a minute and just discuss sobriety and medication-assisted recovery. So medications such as methadone, buprenorphine, Sublocade, they can help control cravings and manage withdrawal symptoms. And they can help people manage their recovery from opioid use and maintain for a long period of time. The decision of how long to take the medication is a personal choice that individual makes with their support team, which can include doctors, peer supports, family, friends, or their counselor. Research shows that generally the longer people remain involved with treatment and continuing care, the more likely they are to benefit. And people in medication-assisted treatment who continue with long-term treatment have better results. And as people progress through their treatment and when they have achieved kind of a long-term maintenance, they are periodically assessed for ongoing medication needs. So generally, medication-assisted treatment has been shown to improve rates of patient survival, again, increase retention in treatment, decrease illicit opiate use, increase a person's ability to gain and maintain employment, improve birth outcomes among pregnant women, and contribute to a lower risk of contracting HIV and hepatitis C by reducing relapse potential. SAMHSA has referred to medication-assisted treatment as a preferred treatment and one that utilizes a whole patient approach to treating substance use disorder. So around 2010, SAMHSA created a task force to kind of come up with that standard definition of recovery that we looked at earlier. Prior to then, there were separate working definitions for mental health recovery versus substance use recovery. So they have compiled those working definitions and identified these dimensions and guiding principles. So 4 dimensions of recovery include health, home, purpose, and community. The ability to make informed, healthy choices that support physical and emotional well-being, safe and stable housing, participation in meaningful daily activities, and the independence and resources to participate in society, and relationships and social networks. The guiding principles, so these are kind of more generalized. We'll get into specifics on the next 2 slides. But generally, recovery is built on strengths, talents, coping abilities, resources, and values. It's holistic. It addresses the whole person and potentially their community. It's characterized by continual growth and improvement in health and wellness, and incorporates the ability to manage setbacks and resilience as a necessary component of effective recovery programming. The 10 guiding principles include hope is person-driven. There are many pathways, holistic, and peer supports. So they view hope as a catalyst of the recovery process and work on internalizing that hope and motivation, which can be fostered by supports. The individual exercises choice over the services and supports that assist their recovery, and recovery really focuses on autonomy and independence. There are many pathways that somebody can use to engage in the recovery process, and that can include things like professional treatment, use of medication, faith-based approaches. Recovery is far from one size fits all. Again, holistic and peer support. So the benefit of sharing of experiential knowledge and skills, as well as social learning components. So recovery support specifically are people that help others stop using drugs and alcohol and begin a life of recovery. Different people find different things supportive, and successful recovery depends on finding and using the support that works best for each individual. Recovery support can include things like transitional housing, employment services, medical care, mental health treatment, childcare, transportation, and other types of services and resources that allow people to move forward in recovery. Sometimes recovery support includes finding a faith-based group that is inspiring, or getting involved in leisure activities or giving back to the community. Additional guiding principles are that recovery is relational. It's supported through relationships and social networks. It's culturally based and influenced. It considers trauma as a precursor to substance use. So recovery programs should be trauma-informed to foster safety and trust. It's built on personal responsibility and is strength-based, and is focused on respect for community systems and societal acceptance for achieving long-term sobriety. So focusing on those aspects of peer supports and being relational, we are kind of transitioning now to types of recovery programs. So there are recovery-oriented systems of care. So those are chronic care management model for severe substance use disorders. That includes longer-term outpatient care, recovery housing, recovery coaching, medication management checkups. There's recovery support services. They refer to a collection of community services that can provide emotional and practical support for continued remission. So things like mutual aid groups, recovery coaching, recovery housing, community centers, and recovery-based education. And recovery and recreational, or I'm sorry, social and recreational recovery infrastructures and social media. So programs that make it easier to enjoy activities and social interactions for people in recovery so that they don't involve drugs or alcohol. So that can be recovery specific cafes and clubhouses, sports leagues, and even creative arts programs. As someone's transitioning out of inpatient treatment and frequently they receive a recommendation of going to support groups, sometimes there can be kind of a lack of understanding from loved ones about the importance of attendance or the point of attendance. So to speak a little bit more about recovery supports and the effectiveness on mutual aid groups, I thought we could discuss relapse and remission. So even after a year or two of remission is achieved through treatment or some other route, it can take 4 or 5 more years before the risk of relapse drops below 15%, which is the level of risk that people in the general population have of developing a substance use disorder in their lifetime. As a result, similar to other chronic conditions, a person with a serious substance use disorder often requires ongoing monitoring and management to maintain remission and provide early reintervention should the person relapse. Recovery support services refer to collections of community services. Just as the development of a substance use disorder involves profound changes in the brain, behavior, and social functioning, the process of recovery also involves changes in these other areas. These changes are typically marked and promoted by acquiring healthy life resources, sometimes referred to as recovery capital, that can provide emotional and practical support for continuing remission, as well as daily structure and rewarding alternatives to substance use. That's why sometimes you'll see in recovery communities things like picnics and dances and fun activities to help individuals learn how to have sober fun. This is kind of a compilation of research that I have come across, and it's a review of research on the effectiveness of self-help mutual aid groups. So this was published most recently in 2002, but I think the information is still helpful to consider. There was one study they mentioned with 25 Alateen members and 25 non-members who had an alcoholic parent, and an additional 25 non-members with no alcoholic parent. Adolescents with an alcoholic parent who were members of Alateen experienced significantly fewer negative moods, significantly more positive moods, and higher self-esteem than those who were not members. In fact, Alateen members had self-esteem and mood scores similar to those of the adolescents who did not have an alcoholic parent. In another study over a period of 3 years, alcoholics who initially chose to attend AA were compared to those who sought help from a professional outpatient treatment provider. There were a total of 201 participants, and those who chose to attend AA had 45% lower average per person treatment cost than those who chose outpatient treatment. Despite lower costs, AA attendees also experienced significant improvements in alcohol consumption, dependent symptoms, adverse consequences, days intoxicated, and depression. A third study, members of Narcotics Anonymous self-help groups, with 200 participants in this study, stayed off drugs for 3 years or more while they were members, and they showed no more anxiety and no less self-esteem than a comparison group of 60 never addicted persons. The longer people remained members while staying off drugs, the less anxiety and the more self-esteem they experienced. And lastly, using a meta-analysis of more than 50 studies, authors reported that AA members stayed sober more if they had an AA sponsor, worked the 12-step of the program, led a meeting, increased their degree of participation over time, sponsored other AA members. The study also found that professionally treated alcoholic patients who attended AA during or after treatment are somewhat more likely to reduce drinking than those who don't attend AA. And membership in AA was also found to reduce physical symptoms and to improve psychological adjustment. So community-based peer recovery supports or mutual aid groups. There are many different types, but some of the similarities include that members share a problem or status. They value learning from others' experiences. They focus on goals for personal change. They are voluntary and self-led. And they offer specific pathways to recovery. So the first one are 12-step mutual aid groups, which are the most well-known type of recovery support service. Alcoholics Anonymous was founded in 1935 in Akron, Ohio. And it's social fellowship plus a 12-step program of action. Most of the research on mutual aid groups have been conducted on AA because it's the most widely accessed for alcohol problems. Research has shown that participation strengthens recovery supporting social networks, increases members' ability to cope with risky social contexts and negative emotions, augments motivation to recover, reduces depression, craving, and impulsivity, and enhances psychological and spiritual well-being. Some strengths of 12-step groups include that they use many of the same mechanisms of behavior change as, therapeutic treatment. There is an aspect of cultural adaptability. So there's been research on populations from diverse racial backgrounds, women, different minorities, and specifically chapters focused on serving minority populations. And 12-step groups are widely available and free of charge. Today, an AA presence can be found in about 180 nations worldwide. And there are plenty of examples of 12-step mutual aid groups, but some of them are Narcotics Anonymous, Cocaine Anonymous, Nar-Anon, and Al-Anon. Those are specifically support groups for family members of people with substance use disorder. CODA, which is Codependence Anonymous, Dual Recovery Anonymous, Medication Assisted Recovery Anonymous. Another well-known option is Smart Recovery, that's self-management and recovery training. The focus is on changing thought patterns to address triggers. It encourages alignment of values and behaviors. It does support the legal use of prescription psychiatric and addiction medications, which again can contrast to some 12-step approaches depending on the meeting and the population. Substance use and activity or process addictions can be addressed using Smart Recovery. It can be a little bit more challenging to find an in-person meeting, but they do have online meetings and discussion boards. Compared to 12-step, SMART recovery is scientific foundation rather than a spiritual one, focuses on self-reliance rather than powerlessness, and encourages attendance for months or years, but probably not a lifetime. The program offers specific tools and techniques for 4 main points of recovery: building and maintaining motivation, coping with urges, managing thoughts, feelings, and behaviors, and living a balanced life. On the Smart Recovery website, they offer a participant toolbox, which includes several worksheets. There's an ABC tool, which uses cognitive behavioral techniques to work on effective change in thinking. There's a cost-benefit analysis, a change plan worksheet, a worksheet on goal setting, an urge log, and what's called a DEADS worksheet, which deals with coping with urges. The next mutual aid group is called Women for Sobriety. It's a peer support program tailored specifically for women with substance use disorder. They focus on being supportive, empowering, life-affirming, and have a secular rather than spiritual focus. They primarily offer online groups, and they also have discussion forums. And they believe that guilt, depression, and low self-esteem are common problems where substance use has become the primary coping mechanism. So they promote behavior change through positive reinforcement, cognitive strategies, what they call letting the body help, which essentially is learning relaxation techniques, meditation, healthy nutrition, and exercise, and dynamic group involvement. They identify 6 levels of recovery, and those are level 1, acceptance of having a substance use disorder, one that requires the cessation of substance use. Level 2, discarding negative thoughts, putting guilt behind, and practicing new ways of viewing and solving problems. Level 3, creating and practicing a new self-image. Level 4, using new attitudes to enforce new behavior patterns. Level 5, improving relationships as a result of our new feelings about ourselves. And level 6, recognizing life's priorities, emotional and spiritual growth, and self-responsibility. They use affirmations too. They have a list of affirmations on their website, and they have suggestions for different affirmations to focus on based on the level. Moderation management. So this one is a bit different than the ones that we talked about so far. So this specifically is a program targeting problem drinking, and it's a behavior change program and a national support group network. It empowers individuals to accept personal responsibility for their choices. It promotes early self-recognition of risky drinking behavior, and it views harm reduction as a worthwhile goal. One main component is they feel that people should not be forced to change in ways they don't willingly choose. Guiding values are that members take personal responsibility for their own recovery from a drinking problem, that helping people is the strength of the organization, people who help others to recover also help themselves, self-esteem and self-management are essential to recovery, and that members treat each other with respect and dignity. So some of those components are pretty comparable to the mutual aid groups we've talked about so far. Some assumptions of moderation management is that people should be offered a choice of behavior change goals, that harmful drinking habits should be addressed at a very early stage before problems become severe, that people can make informed choices about moderation or abstinence goals based on educational information and experiences shared at self-help groups, and that moderation is a natural part of the process from harmful drinking, whether moderation or abstinence becomes the final goal. Most individuals who are able to maintain total abstinence first attempted to reduce their drinking unsuccessfully, and that moderation programs shorten the process of discovering if moderation is a workable solution by providing concrete guidelines about the limits of moderate alcohol consumption. Interestingly, the Moderation Management Recovery Program recommends abstinence for the first 30 days. So even with moderation management, abstinence is still a component to some extent. Refuge recovery is a Buddhist path to recovering from addiction. It's Buddhist-oriented, non-theistic, and it is an approach to treating and recovering from all forms of addiction. Meditation is viewed as the cornerstone of the path, and there are recordings and transcripts of different meditations on the site. Their program outlines 4 truths, and those are that addiction creates suffering, the cause of addiction is repetitive craving, recovery is possible, and the path to recovery is available through their 8-fold path. Secular Organizations for Sobriety was founded in 1985. And again, an autonomous, non-professional local group. They focus on a self-empowerment approach that maintains that sobriety is a separate issue from everything else. It addresses abstinence as priority 1, no matter what. It encourages the use of the scientific method to understand alcoholism. And they also offer, it's called SOS Friends and Family, a support group for loved ones of those experiencing substance use disorder. And a lot of their general principles are similar to 12-step principles. LifeRing is the last one that we'll talk about today, and again, is a secular recovery program. It's abstinence-based. It supports the effort to strengthen the sober self and weaken the addict self. So it says that the meetings, whether in person or online, consist of addicts using their sober self to connect with the sober self of other addicts. They share advice, understanding, and encouragement, and focus primarily on their current lives, not on the hurts and damages of the past. 2 addicts talking sober self to sober self, learn from each other, and gain strength from each other. Part of their process is building personal recovery plans. And they have a 3S philosophy: sobriety, secularity, and self-help. They also view that sobriety is abstinence-based and practices the sobriety priority. We do not drink or use no matter what. It welcomes people of all or no faith, and participants' religious beliefs remain private. The key to recovery is that the individual's own motivation and effort. The group process reinforces the individual's inner motivation to stay sober. And here are a list of mutual aid resources for all the ones that we mentioned today. You are able to find potentially in-person meetings, but online meetings for all of them certainly. And many of them also have those discussion boards, like I mentioned. So this could be a really good resource for loved ones who may be struggling to find 12-step programs as a good fit. There are other options to help them move forward in the recovery and gain those important resources from peer support programs. So that will conclude our presentation, our webinar for today. Please join us next month. Please watch for our invitation. And thank you for your time.